Hi there, this is just a follow-up video to one I done earlier, just in relation to pilonidal sinuses, pilonidal cysts. The last one I done was around a month ago. Since that time, the wound that I've been recovering from has been healing. Uh, well, it hasn't been. Yeah, well, it's been healing. Just not to, I suppose, the extent which we thought by this time it would be, completely healed. I had an appointment on Thursday, 2 days ago, with the consultant who's looking after me. This was instigated by the people that are looking after me in the dressings once a week, so that obviously, an update needed to be done regarding the consultant who's looking after me. Um, there's a bit of bleeding earlier on in that week, which hasn't really been happening. Like the wound itself for the past 3 weeks since I got the vacuum off, has been, has been getting there. It's been getting smaller. But I noticed a bit of bleeding on Tuesday last, so it was 2 days before I was meant to see the surgeon. It was only one day after the dressing had been changed again. There's been very little on any of the dressings in terms of the wound closing over now. It's still a wound, but like it is closing over. It's just we're at the 4 month mark now, so just to recap from the other video that I made, it was probably a bit long winded. There was a lot of things I was probably trying to discuss in it, but um, yeah. So it was from the first operation. So what they had done was closed it with stitches, and in the lower section of it, the last 1/3 of the sinus they had identified. What they done was put a thing called a ceton in. So that's spelled Seton. It is rising in popularity in terms of trying to treat these things, especially the ones that are south of that area, even more so. The ones that are in that like the rectal region, or in around the anus and all that. The ones that are, I suppose, more problematic. So when they took that out, a couple of months back when they done my operation, I believe that was just taken out. It's a piece of plastic tubing, in reality is what it is, and it loops around. There's two holes made, um, one on either end of where sinus tract is identified, and the purpose of that is to allow the fistula, is what it's called, so that that area of nothingness, and all that infection and all, to drain out of the body. Um, so basically, with my first operation, they took out 2/3 of what they believed was the sinus. They left 1/3 in because of the length of the sinus, and they made a decision that if they had have done all of it in one go, that it was probably too big of a wound to heal at the time. I suppose in any instance anyway, the second operation that I had basically cut out most of that area anyway. And then just underneath that, there was probably two holes there that were remnants from that basically piece of steel, or sorry, piece of plastic. Excuse me, piece of plastic tubing is essentially what it is. And it's just tied on the outside, so that it loops through the skin. They tie it then on the outside, and basically that's to leave that tract open. Whatever crap is in there, shall we say, the idea of it is just to let that drain out, and as well as that, what it tends to do is bring the sinus more closer to the surface. So the more of a gap, I suppose, in track and the channel, and the deeper that it is in your back, uh, the bigger issue it is. So it does two things: it allows it to drain, and to a certain extent, it allows the whatever tract is there to come out towards the surface as much as possible, so that obviously they don't have to go in as deep, as they would have to if that wasn't there. The bleeding, they said, is from that they've seen the other day, is from not from the wound that I'm healing from at the moment, but just below that. Um, so they want to put me back into an operation again. Um, so we were in a position, I suppose, in the last couple of weeks where we thought I'd possibly be back and work by Halloween. Um, Now we're not so sure. like I will reiterate, there could be nothing in this. My surgeon just wants to be very, very sure that there's not a new track there that's after opening up, or a new one that's after forming. And I suppose it's just coming to I suppose, the truth of what these things are. You can be very close to getting to the end, or what you believe is the end, and for one of these other ones to form again. Is Thursday wasn't such a good day leaving there after being told that, but I'm trying to reiterate from it that this could be as a result of the two holes that were there from that seat on that was being placed, and relatively it had only started around a day or two before this. It hasn't been anything ongoing in terms of that, but it could be a certain section there, and obviously the worries is there. So if you know, look, if you're going through it, or if you have gone through it, you'll know how I feel. Um, Very deflated on Thursday, and I suppose just to put some truth out there with these things, once you get rid of them, it's not like they're not going to come back again. It's not putting a negative spin on it, but I suppose the actual fear that it sets into a person. And like I said, if you've went through this before, you'll know where I'm coming from. You know, they're of the opinion that they want to go in and just have a look for a couple of minutes, but they need to put me to sleep because it'll be too sore otherwise. So I suppose it's a balancing act of healing the wound that you're getting over. You know, you're getting over from 4 months ago, which is in my case my second operation. So if this goes ahead, it'll be my third operation within the space of a year. And I suppose, like, the first one you're optimistic, the second one you're thinking, well, I don't want to, I don't want to be too optimistic, but I know this will probably be it. And then this is just another, I suppose. It comes down to what the truth about this disease is, and it is a disease. Um, Mentally draining, physically doesn't really. It just inhibits you. You can't really do a whole lot. Um, some people come out of it grand. They get caught in time, or it's not that deep or whatever. Like, you could have it for years, and look, you might get away with it. It mightn't be so deep. Other people, or look, there's no point, I suppose, in feeling sorry for yourself. You're allowed to do that, I suppose, certain times, because you need that valve of. There'll be days where you'll fight it. Any normal person with any sort of positivity in them is it's going to have a day where um they're going to just wake up and go, well, I'm not going to let it get me down today. And then you'll have days where you feel like absolute shite. That's what I felt like on Thursday. I just came home, I fell asleep, basically lying down flat on my stomach like I normally do. The way of being accustomed to lying. But it's the small things that, I suppose, if it's something big, like, there's obviously lots of people out there that are in and out of hospitals, and they're in a bad way, and at the same time you have to think, like, there's no point in whinging too much, because it could be worse. Like, you could have a fatal disease or something, or I think this, in the way this thing is it's fatal to your mental health if you don't watch it. I know it went into great lengths of talking about this in the other video. Like I said, it was probably a bit more long-winded, but as we get towards the end, I suppose we want to get to more specifics about things. Like, it's the simple things of not being able to sit down. For me, not being able to go and do my job. I'm just fortunate that I did get a good job. Worked for a lot of years, going to college and going to school and all that stuff, trying to get myself as educated as I can, and not just stop there, but trying to push on, getting extra professional qualifications and learning new skills outside of work, web development, that sort of things, different coding languages. I work with data a fair bit, and it's always been an interest of mine. So for me not to be able to go to work, and I know it sounds stupid because you think, oh, sure, it's great to be off work, but it's not, because you have to be doing something. and the type of person I am is I need to be out and about and I need to be doing things. You know, that for me is the hardest thing. Aside from that, like it's normal things. Like I said, being able to sit down, just normally have your dinner. Like different family events. Like if you can't go away and do something, um, just go out for a bit of dinner with your partner or whatever. These are small things, like, and that's the true downside of something like this. It's grand, like if it's a straightforward procedure, but I suppose the statistics, I don't know what they are in terms of people that don't get over these things quickly. If it's caught and it's not too bad, and you get over it in a couple of weeks, like it's like breaking a fucking arm or a leg or something. 5-6 weeks and you're grand, and you don't worry about it again. Uh, but for those of us that are suffering from this for an extended period of time, I just feel for those other people as well that are going through it. I feel better actually than I felt in a long time in terms of the wound that I got operated on 4 months ago. Especially in the last couple of days, like since I seen that surgeon, my consultant on Thursday, I suppose I've some decisions to make in regards to it. They want to go in and just have a look, but I suppose the last two times it was, it's not going to be too bad, X, Y, and Z. Look, these people are professionals. They go through a lot of, you know, uh, a lot of training and that, and they obviously have a lot of experience. But at the same time, you have to look at it from the perspective of what's good for you. These type of disease is that you don't know what the turnaround time is. Um, so I suppose with this one, it's a choice of if there is something there, is a question of what am I being told? Have I been told everything? I suppose um, you would hope that everyone is straightforward with you, but I suppose if it's a very, very hard thing to try and tell somebody that they might have issues that are ongoing, they might need multiple operations. They might just be telling you everything is fine for the sake of it, and then but knowing in the background that this person's going to need a number of operations. So instead of telling them, Jesus, you're going to need 6 operations, or Jesus, you've multiple tracks running here, there, and everywhere. I suppose I'm the sort of person that needs to know what I'm up against. And like I suppose the question in my mind now is that if I'm looking down the barrel of this for a third time in a year, what exactly is the extent of it? I'm sure I'm sure that if it was something serious, like a serious illness, and there, like I said, there is people out there that are very, very ill, and you know, maybe have terminal illnesses. So there's no point in someone like me probably feeling too sorry for myself. That life could be worse. Yeah, it absolutely could be. But at the same time, you have to look at your own mental health and your own aspirations as a person. Um, Even those that have the strongest mental thing, like mental fortitude or strength in their own mind, if you can't do anything for an extended period of time, it's like being in a prison. Even though you're in your own comfort of your own home or wherever you are, not being able to do elementary things, uh, it will zap away at you over time. I don't care who you are or how strong you are in your mind. Well, maybe I'm wrong, but in my own experience, that the truth about these things is the mental health side, and that's the toll that it's going to take on you. Even such things as getting a haircut or whatever, probably going to have to get one at home now, because if or try to get one, or have someone do it at home. Like it's small little things like this that are you wouldn't think about in a normal day to day thing. Um, like we have to look at it that you know not everyone gets them, and that's brilliant because Jesus, like uh, we don't know what the true figures are, and we just know from kind of some statistics that Doesn't tend to be. It is common, more common in men than women. We know that, and like I suppose there's other treatment options there as well that are coming out, like laser and that I didn't even realize existed until a few days ago. That there's places that are doing laser now that's actually going into to the tract and actually lasering it shut, which is absolutely mind-boggling. I actually seen a video of it on YouTube the other day. Um, like unbelievable to look at in terms of very very quickly done. It what it does is find the length of it, seals it from the bottom, and at the same time kills all that stuff that's in there as well. Um, Unbelievable. Like if something like that was possible going forward for people with these, I don't think there'd be as much of a problem. The problem is obviously not knowing the length. And I suppose the confusion about this possible third surgery is a result of how do you determine where it starts and where it ends. Like mine was discussed that there was a dye put into it the second time to actually figure out where it started, where it ended. Believe that dye it may have been something like methylene blue, is what I understand from just my own research. May have been injected. So what that does is kind of shows them where the gaps are in it and what gives them a fair idea. But like that obviously has its own drawbacks as well. It's not 100% reliable according to other surgeons. So it's all of a matter of what techniques are being used as well. Um, but yeah, like I suppose I'm in a funny place at the moment where I'm in recovery from a surgery I've had 4 months ago that was meant to rectify this, and I'm in a situation now where I'm not sure if there's something existing there, or there has been since the start and I haven't been told. I suppose that's going to be quite easy to find out with my notes, which I'm going to um, have reviewed. I just want to be sure that I'm being told what the exact thing is. Like my reaction to getting called for surgery each time is that I kind of go into a bit of a shock, and I'm tending to ask too many questions in a flurry to my surgeon or doctor. They're not quite able to answer them. Everyone's going to be different. I suppose I need to know what the extent of this is, or to the best extent that they know. Uh, I don't want to wake up again in a situation where this will be the third time, and they're not meant to be bad operations. But when you see, because you give your consent that if they find something extra that obviously you can give or not give your consent, but of course you're going to give consent because especially the country that I'm in, it's very hard to get into a theatre to get an operation. There's waiting lists. People are waiting years that are much more ill than I am, that are waiting for transplants and for all sorts of different things. Like, and it's a fucking no brainer. Like, of course you're going to say, yeah, well, sure. Look, if you find more of a track there, sure, like go on ahead and get rid of it. Or you don't know when you're waking up, basically, what you have to deal with, and that's what I have an issue with. Like you need with these things, especially for me, and I suppose everyone is going to be different, but you need to know what's good for you to a certain degree. That we have to look at things a couple of different ways here. Um, any wound, so anytime the skin is broken, like over an extended period, like cuts and scrapes are different. They're going to heal within a short period of time. But if you've been operated on, or there's been part of your body removed or cut out, right, that has to heal obviously, and it just depends on where it is and the length, depth, width of the wound, all these other things, and your own healing capabilities um that determines how much you heal. But your skin is only ever going to be 70 to 80%. That's a proven medical fact. So obviously, the more times that somebody is starting to go and alter that part of your body, or any part, it means that it means that obviously you're going to have to watch it going forward. So if you're in a job where you're required to sit for periods of time, or that there's a consistent stress on that part of your body, then obviously 70 to 80% is grand. It's better than having a fucking sinus that's spewing out pus and bleeding and, causing severe swelling and pain for people. Those that have had it will know the pain of it. Um, I know what I'd prefer, like, is to have a heal to 70 per 80%, and get on with it and just hope that it doesn't come back. Get your laser hair removal, because that seems to be a consistent, I suppose, thing in the literature nowadays from medical journals, is that laser hair seems to stop it reoccurring anyway. There is debate on whether to leave the area shaved or not, but they're saying is laser hair removal once you're healed up seems to be, you know, universally kind of, said to, obviously, because it kills the follicle, I believe. And the issue with the sinus in the first instance is the follicle. There's some sort of malfunction there, and that breaks down. So if you can kill that, I suppose, at the source, then there's no follicles or hair in that region that can be given a chance to break off or find a pit of skin where there's a hole in it. And obviously, we're talking about microscopic things here. Like, um, you're talking about microscopic things. You mightn't ever see it. It could be a hair that you'll never see breaking the skin and could grow back in. So you have to understand that if there's some malfunction there underneath, the problem is like an iceberg, I suppose. It's the best way of that being described to me as um, an iceberg. Like with an iceberg, you're only going to see certain parts of it. It's only till you kind of go beneath the surface. There could be multiple channels running off it. Like, I suppose in my instance, I'm fortunate to some way in terms of what I understand of mine, is that it's a straight line down. You still don't want that anyway, but I'm starting to worry now that what they've taken out, which was around 10 centimeters long, it was about 4 or 5 centimeters wide, and it was around 1 centimeter deep. So it's by far not the worst one that I've heard of, but it's still not pleasant to deal with. When you have a wound that size and it's bleeding for weeks and weeks upon end, and you're trying to just maneuver on a day-to-day basis, just even get around the house or whatever it is, you're bedridden for months on an end, basically. Obviously, you can see that I'm in bed at the moment. There's not a whole lot you can do for an extended period of time. I suppose the worry is that if it's gone further south than that, or if it always was and they just didn't want to tell me, um, then that's the one that I fear the most, and that's why this week's news has not been welcome. Um, I suppose I just wanted it to serve as a reminder to everyone that even if they're gone, they can come back, and even if you think you've been healed from them or healing from them, like, they took out extra tissue from me when they injected this dye, and like I said, it's not 100% reliable, but it's definitely in the best practices now in regards to these things. Uh, when they're being taken out of the body, that in order to get some sort of reliable information on it, they either probe it, which is obviously logical, and see where the probe stops. That'll give them a fair identification of where it starts, where it ends. The blue dye also has been used extensively, methylene blue, I think, in order to identify whatever, if it's a single tract or multiple tracts. The ones that branch out tend to branch out laterally, so I've seen. So if you've one running from your lower back down between the crease of your buttocks, if it does branch out, it's most likely going to branch out laterally. But obviously, like, if you've one that's running in the single line, it's probably easier to deal with from a surgical aspect, of course. But there's still a chance there. Like, I suppose the wound that I have is my lower back, above the crease of my buttocks. Mine was higher up than normal, which, you you don't want any wound like that anyway. But if I was to take one, I'd take the one that I had in terms of it being higher up the tailbone. You don't want them lower, going into that region of, it's going down near you know your butt crack or whatever. Um, but there's definitely seems to be things that people are predisposed to these things. That's for sure. The research out there will say that if you're sitting for long periods of time, men more than women, those that are have thicker body hair than others, things like this. There's some of us that are going to be predisposed to it. There's some of us that may not have any body hair at all. Um, that can they can still happen. Like it's an issue that's happening within the skin and the subcutaneous tissues where you don't see it. It could just be a reaction of some sort. You mightn't even have a great amount of body hair or none at all. Like it can happen to women as well. Like, and obviously men are going to be hairier than women. Um, it can happen to anyone. That I suppose that's the sad thing. It's not just if you've got body hair or you've got this or you've got that. It can happen to anyone. That's the truth of it. If you fall a certain way onto your tailbone, I've heard that can cause it as well. Um, it's truly frightening. Uh, how this can be putting so many people out of work. And like, I'm fortunate that I've no kids or you know and like had to be looking after that. I couldn't even pick up my own kids. I suppose that would probably be even worse on me. I suppose there's some days I struggle even as it is. Like, and I'm still only 28 years of age, and obviously that's something I'd like in my future life is to have my girlfriend and myself to have our own family and to get married and all that stuff. This is this amongst other just things that have come up over the past 2 years. This being, I suppose, the thing that has halted everything in terms of life in general. Um, like the thing about it is they're so uncertain. Like your employment. Like they're only going to be around for a certain period of time before, if you don't get better, the state will only look after you to a certain time, and so will your work. And that's the way employment is. You you are dependent on your own health to get you up and out of that bed every morning to work to get your money, to make your money, so that you can save up, you can do whatever it is. Your own health, that being a deterrent, is very difficult. That in your own mind you're ready to do things, your body is not letting you do those things. That's the difficult part. Um, you just want to get on with it, and you can't get on with it. Unfortunately, there's a lot of things you can kind of struggle through, I suppose. Uh, this is not one of them, I don't think. In terms of, well, like I'll still be able to go to work, or I'll still be able to do this or that. You're in a situation now where you're two surgeries in, possibly a third one to be looked at. I'm just hoping that it's just the way the plaster was sitting on it, or something. Could be just something small. You know, a scab or whatever that was got interrupted or something. Personally speaking, I don't know. I don't feel like I could have another one there, but maybe I do. Um, I suppose that will all come down to whether this was seen from the beginning or not. And I suppose the third time you're around, you're looking at going, like, what are my options here? Do you know? I think it's taken me to a stage where you're looking at two times down the barrel of it. Grand, I can deal with that. The third one, I can't really deal with it at the moment. The thought of having to go through this again, or for them to cut another piece of skin away, or God only knows, anywhere else on the body, like if it was further up the back or whatever, your stomach, it's different. Like that area is going to fucking heal over time, and I suppose you have to. I suppose there comes a time when you have to stop rolling the dice on it. I suppose because it's your health at the end of the day, and you can just look at it and go, yeah, yeah, let's get it done, let's get it done. But it's probably the time to be looking at it, going, this has to be right this time around. I think. You know, that's in my own mind. Um, it's not to put dampers on anything. There's people out there that are obviously worse off than myself. You know what I mean? There's people out there that are going through it much worse than myself or other people are, and still getting on with it. I suppose it's just been in a funny situation where you just don't know what's coming next. Every time you go under the knife, you think it's going to be this time. You know, and there's only so many times you can roll the dice with it, I suppose, is what I'm saying. Um, it's just a look, I suppose, just at different moods you go through. You know, this is the reality of it. It's not easy. There will be days where you'll fight it and you'll rally against it, and there's days where you just can't do it. That's the truth of it. The longer hours that we're working and the more commuting we're doing, uh, the more people that are, sitting down for their jobs. I'm just worried that it's not known. See if we knew when we grew up, or when we were growing up, that these things were such an issue. See, because they're not that widespread, but at the same time they are. Um, like I was saying before, I think it's 26 per 100,000 in the UK or in the US. I can't quite remember. So that's not a big figure, really, is it? In either of those populations, just as a sample data. I think it was the UK. If I stand to be corrected on that, but that's not a lot of people in terms of the occurrence rate. But I suppose, look, it's well known in the medical circles that these are a big problem. That's both for surgeons and patients alike, and it's very hard to manage expectations. People can't answer your questions because they don't know until they go in. It's not like other things that go on medically like that. They'll be able to give you a certain degree of certainty. With this, they don't know. I suppose I have gotten an understanding of that over time, is that, like, I don't know when I'm going back to work. For me, when am I going to be able to sit again? They can't answer any of these questions because they don't know. Like, the purpose of a visit there on Thursday was that the wound was getting to be better. It still was there, but it was getting smaller week by week. It was improving bit by bit. Like, it's a long road, so I know that eventually it will heal. There's no doubt about that, because that's the way the human body is. Like, it will heal eventually. Um, but they can't answer that question until they go in and have a look at you. And then it's a kind of on the spot fucking decision that, right, well, this is what we're going to do, and hopefully this solves it. Like, but there's no guarantees. Like, every time you wake up, it's, oh well, look, we thought we got it. We should be grand this time. And that's the way it was the last time. They even told me they took an extra 2 centimeters of healthy skin away, just to be on the safe side. So that's why I'm hoping that this is just as a result of this Seaton area that they had in before. Which, in fairness, if I was cutting out that much, I probably just would have cut out anyway, in hindsight, because that's where they'd identified the first time that was the 1/3 that was left in. I would have thought you would just cut that out anyway, just to be on the safe side. Like, for me, the main thing after my second operation was ensuring that it wasn't going any further than decreasing my buttocks, which is good news for me. It's good news in general, because you don't want to be getting down into that area, because if you're sitting down, the pressure of that going forward is going to be stratospheric. Even if it's your lower back, it's still bad, but you don't want to be getting down into that area where, when you're sitting down, even on the toilet or whatever, it's going to become a problem. That's the one that I fear the most, and that's what this news is. That I'm just hoping that it's not going to be a case where miraculously some new tract is growing, or that, look, if it has, I wouldn't believe it. I would think that it was there the whole time, because there's no way you wouldn't be able to see that from cutting out that much flesh. It's just, it's hard to deal with, and it's hard to think, like, are they just trying to maintain your expectations just so you don't kind of go mad or whatever, or are they trying to not tell you something that they might have known all along? I'd rather just be told in the beginning, like, you're fucked. Well, you know what I mean. Like, in realistic purposes, I need to be told that this is the situation, this is how bad it is, and right, this is what we think we're going to be able to do. Because at that stage, you would think, right, well, I might need a specialist if it's so bad. Like, if it's a general thing, I'm not going to be so worried about it. Now, you have to look at it and go, well, what is my options? Because even at that stage, if I'd known how bad it was, even on the first one, and if you know, that's presuming I haven't been told everything, I probably would have postponed it, because look, it was manageable. It wasn't great. It was exuding a bit of blood and that. But look, you could have dealt with it for the time being, got yourself on a plane somewhere and done some sort of mad surgery, like I said, with the lasers. There's lots of places in Europe that are doing it. I'm trying to follow up and see, is there places in Ireland that have done it too and have experience doing it. Because see, the problem is, like, if you're trying to get specialist treatment now and I'm in Ireland, if there's not a specialist that I can find that'll do it, and I want to get, say, a laser done, sure, how am I meant to get on a plane now? Can't even sit down. I haven't sat down in 4 months. Not to say that I can't. I'm sure that I could and try go down and sit on the sofa there. The problem is, like, a wound like that needs to be fully epithelialized, and even at that, like what I was mentioning before, it's only 70 to 80% of the pre-tensile strength is what they say. So, like, there's nothing stopping me as such to go down and sit down on the sofa if I wanted to. I've just been told not to for medical reasons. It's, I suppose, a little bit all over the place, but what I'm trying to say is, you have to look at it for what it is. It's the dog behind me, sorry. You have to look at it for what it is. And I suppose, like, I feel fine since that Thursday, but at the back of my mind, I'm thinking, if they want to just make sure, that's fine. But I suppose my previous two things in there has not been, we just want to make sure. It's just, I don't want to wake up again and to start this process all over again. I suppose I've no choice. If that's what's happened to me, then I have to accept it. It could have even grown further, I don't know, but I don't think that is the case. And I'm hoping, obviously, that it's not the case. Like, I'd rather just be back in work, you know. I said to the consultant, like, well, you know, what do I say to my employer? Like, it's, will I be back before Christmas or will I not? Will I sit down again? Will I not? Do you know? Yeah, like, you will sit down again, but, like, we just don't know when this is going to be healed. So I said, look, what do I tell them? I'm not going to be back anytime soon. So I didn't say that, is what he said. So maybe they're just being overcautious. I've grave faith. I've grave faith in the medical professionals in this country. I've grave faith in medical professionals anyway. It doesn't matter where they're from or who they are. Like, maybe they're just being very careful with me, that they don't want to send me back now in the next 2 or 3 weeks once my wound heals, to find that there's another one there, or there's something that should have been looked at. Like, if it's a minor one, I don't mind as much, but if they're going to do a big job like what they've done before, but it's down lower, I think for me, I'd need to be prepared for it mentally.